Well, welcome everybody to week 3 of our July online program for the alumni of the Sunshine Coast Health Center up here in Powell River, British Columbia. And this month we've been talking about drug prevention programs. What works, what doesn't. And the idea is if we can figure this out, maybe it'll give us a clue as to what the addiction is. So this week, I'll talk to you about some brand new research that's come out. And basically this research, probably 2005 and beyond, although some of it came from maybe 2000. And a lot of it published in 2008 for some reason. But the researchers are basically looking at these drug prevention programs and saying, yeah, they aren't working so hot. So we must be missing something. So what are we missing? And they're beginning to get the idea of what they're missing is the reasons that young people use drugs. And they're missing that because they've always taken this approach that drugs are bad, don't do them. In other words, there are no rewards, there are no benefits, there are no payoffs, there's no positive experience, it's just bad. So stay away from it because you're risking death and it'll deplete your finances and it'll hurt you physically and break up your family, all that kind of stuff. Okay? So the new brand of researcher is taking a new tactic, and what they're doing is they're going out to young people, usually age 15 to 24 is considered the youth, and they're asking them, well, why do you take drugs? Like, what is the positive experience you are discovering from using drugs? And it's interesting what they're discovering when they ask that question. And by the way, the reason that they didn't ask this question before was they always considered young people vulnerable, and or the way you could look at it is the young people were not adults. And because they were not adults, they were incapable of making good decisions and therefore had to be protected. So the idea of asking a young person, why did you do drugs, didn't make a lot of sense to them. Because, I mean, why would you trust someone who's not an adult, who is incapable of making good decisions? The new researchers say, no, this is valuable to listen to the young people, to tell us why they use drugs. And they've been discovering all sorts of interesting things. Last week I mentioned that one of the things they discovered was that young people, if they make the decision to use illegal drugs, they actually felt more independent, more autonomous, more grown up. But two of the big things that we keep hearing from the young people are, one, when you do drugs, there's this social element to it. And a lot of this research was actually done at dance clubs. These, not so much these things called raves, but these, we gotta remember the name of the electronic dance clubs, which are apparently illegal things, but lots of young people go to there and take ecstasy and stuff. Anyway, so they're asking young people going to these illegal dance clubs and taking ecstasy why they used ecstasy. And what they discovered was ecstasy facilitates this feeling of social cohesion. So that they get this communal feeling. And so that was interesting. And the other thing they talked about, apart from this social cohesion, was the feeling that the drug transforms the ordinary and gives them an experience. So here's the daily, everyday world, which is kind of boring. Use the drugs, and all of a sudden the world just blossoms, and life is much more exciting, much more interesting. They feel more alive, more vibrant, or what the researchers call this feeling of transcendence, or perhaps even a connection with some force in the universe, right? So these two things, the social thing and this transformation, these are very powerful benefits that the young people claim to find in using drugs. So that's really quite interesting. And by the way, a lot of this research was done in Britain. We're not quite sure why. Probably doesn't really adhere as much to the war on drugs thinking. But there has actually been a bunch of research coming out of California, again, looking at different drugs, including cough medicine, that dextromorphin and cough medicine, and also not only ecstasy, but also cannabis and a whole bunch of other drugs. And so there's sort of the California group, which makes sense because it's California, and a big group out of Britain looking at what are the rewards of being intoxicated? What's the positive experience? What are the benefits? And then, and in this in this research, we're finding these two big things: this what's called pro-social, this social cohesion, and the second thing is this feeling of transcendence, that I'm rising above this ordinary world. Anyway, next week, yeah, we'll see. We'll pursue this a little more and see if we can get some more insight into but the reasons that young people use drugs. And maybe that'll help us figure out a drug prevention program that has better success than the ones we currently have. Anyway, see you then.